Good afternoon and welcome. Thank you for joining us today. I'm Samantha Watson, the Director of Business and Partner Services for the Florida Association of ACOs. I'm excited for this opportunity to present to you our next installment of our webinar series, Innovation in Home Care, Integrating Digital Solutions for Improved Patient Outcomes. Before we get started today, I'd like to go over a few items so you know how to participate in today's event. You will see a user control panel on your computer desktop. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the arrow up on the mute button and choose switch to phone audio, and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the Questions tab. You may send in your questions at any time during this presentation. We will collect these and address them during the Q&A session at the end of today's presentation, or you can raise your hand and we will unmute you to ask your questions directly to our presenter. I would like to introduce to you Greg
Gutkowski.
I laughed because I just asked him how to say it, and now I can't say it. But Greg has over 30 years of global business experience spanning from marketing, sales, and IT management, as well as internet software development, advanced data analytics, and journalism. Greg is a best-selling author and has earned advanced degrees in IT management, economics, and journalism. He is a co-founder of Personal Health Monitoring, a virtual healthcare company located in Jacksonville, Florida. He also teaches business analytics and digital strategies at the University of North Florida College of Business. I'd like to also introduce Charles Bell. He is a co-founder and author as well. Charles is a seasoned entrepreneur with more than 35 years of healthcare technology experience. He is one of the first pioneers of digitizing the patient experience. Charles has co-founded and managed several successful national and international healthcare technology companies. In 1984, he installed his first central command center, a virtual care center focused on delivering the best patient experience. The system allowed to manage all patient-related communication. Since then, his system has been implemented in over 200 hospitals. He is also the co-founder of Personal Health Monitoring. With that, I'm going to pass it over to Craig to get us started today.
Hi, good afternoon. Thank you all for joining us, and I look forward to sharing with you some of our thoughts on trends toward healthcare at home. So I will start my presentation, and the agenda for today is we would like to start with presenting very quickly our vision and talk about trends that drive the in-home care and the benefits of those. We will also talk about progress in technologies in general, digital technologies, and that enable that a lot of new models for healthcare at home. And we'll close with the very relevant case study, and that will highlight all the features and benefits of this approach. Together with Charles, we are both co-founders of Personal Health Monitoring. We wrote our second book on healthcare. In this case, we summarized all the practical and feasible solutions today, technological and process solutions and business models that enable in-home care. And we're also discussing the future developments, things that are coming down the pike, so to speak, as far as what's feasible down the road and how those technologies can support this trend. One of the trends that drives in-home care is the very, very frustrating trend toward increased expenditures for home care. For healthcare, I'm sorry, in the United States. It's not just United States, it's partially driven by aging population, but it's also driven by a lot of very, very high cost of hospitalizations and senior living. So healthcare as a percentage of GDP went up from about 7% to almost 18%. That's a very substantial share of GDP, and it's the largest in the developed world. Nobody else has such a large share of GDP. So it's both in percentage terms and in the terms of absolute expenses. But what's interesting on the positive side, in the same time frame, the cost of computing, what I mean by computing costs, I'm talking about cost of not just cloud computing, but smartphones are the best example. You know, the power of computing that we have on our smartphones 30 years ago would cost $4 million. That's one of the things, the only thing that I know in the world that went down 10,000 times over 25 years as far as the cost of equivalent amount of computing. So we are really walking around with supercomputers in our pockets. And as I mentioned, it will be in millions of dollars just 30 years ago. So this trend is driving more and more services being deployed at home. And we'll talk about in detail a specific example of technologies that take advantage of this trend. So we have increased cost and decreased cost of computing. McKinsey wrote the article several months ago saying that up to over 260 billion worth of care services, Medicare fee-for-service, and Advantage beneficiaries could shift to home by 2025. We indeed see this shift as happening right now, driven exactly by those trends: increased cost and increased cost of healthcare and decreased cost of technology. The trend that we see is regardless of what nomenclature we use or terminology we use, it's either virtual or hybrid healthcare. The idea is, you know, how much can we push the telemedicine to homes? When is it relevant? And what percentage of all overall care can be delivered virtually? From COVID, we learned that that percentage is pretty high and it's only growing. But at the same time, we know that certain procedures will never be done, certain outpatient procedures will never be done at homes. They will require coming to the physical location. So we think that the trick is to combine the virtual healthcare as much as possible with the necessary visit when the physical contact is basically impossible. The diagnosis or treatment has to happen in the brick and mortar location. And so the idea is how can we coordinate care at home by providing access virtually to primary doctors, virtually to specialists. That's very important, especially in Florida, because the waiting list right now for visiting specialists could be several months. With telehealth, we can shorten this to 48 hours. How can we have nurses or nurse practitioners being virtual or being at home skilled nursing? And last but not least, what we call the last yard of the healthcare, how can we coordinate, manage better nurse assistants? You know, if you have a home care, all of this will then down translate to the services that can be delivered by nurse assistants. So we have to coordinate all of those, this continuum from very sophisticated telehealth services all the way down to the physical services of nurse assistants. So what are the best ways of doing that? We'll be discussing this in that presentation. Idea again is to shift as much of this to the virtual world as practical. And one more point here, that the idea would be, you know, where the technology can help is how can we combine measurements and tracking locally with the smartphone apps for patients, and at the same time visibility for healthcare providers. Let's talk about on the very positive side, where we see the major blocks of benefits. First, from the patient perspective, because that's probably the most important perspective here. What are the patient going to get out of it? We think by them staying at home and being at home, aging at home, that really prolongs healthy lifestyle. We are not taking them away from the comfort level of homes. They can have the privacy of it. They're familiar with it. There are a lot of studies showing that the outcomes are much better if healthcare is delivered at home, of course, everything else being equal. We think, and we'll demonstrate it down the road later on in our presentation, how we can be proactive and do preventive healthcare remotely. That will tie to monitoring, to remote patient monitoring. We all know about the convenience factor. You know, the seniors, especially senior people, may, even if they're affluent, they may have a problem driving. You know, so why let's cut down all the travel and going to pharmacies. Anything can be delivered to homes, or anything that can be transacted at home prevents them from having to drive. I talked about already quicker access to specialists. We think also that there's a great opportunity to involve family members in the care. Today, the technologies allow for any type of treatment, teletreatment, to be shared with family members or caregivers. So we can imagine, not imagine actually, it's what's happening. Let's say I have my retired parents in Florida, but I work in Arizona. You know, how can I get involved in their care? And today, the communication technologies, we can create alerts, and we create any type of groups and support groups online for parents or for patients that have similar conditions. We, of course, one of the big benefits from more frequent interaction and monitoring is the decrease in emergency room visits and hospital admissions. There's improved medication adherence. People we all know that this is a big part of the problem. And last but not least, cost savings. You know, fewer medications, reduced transportation, fewer co-payments. On the payers and the providers side, we see several studies showing that with the very good monitoring and in-home care, we can reduce claims up to 54%. Readmission rates, that's another one. We all know that the admission rates are very high in the hospitals. How can we do that? So if we get the patient readmitted and that person is given extremely good care at home, the probability of readmission goes considerably down. We can also reduce the unnecessary emergency visits. If somebody is measuring the blood pressure daily and the glucose daily and the activities daily, the probability of detecting the problem before it becomes emergency visit candidate is increased. Patients, as I mentioned, they prefer to stay at home in the privacy of their homes rather than going to hospitals. And it's interesting, the medication and adherence is extremely important, because first, we tend to be over-medicated, but on top of it, especially older patients may forget to take the medication. So tracking the medication adherence through smartphones is one of the ways to do that. Let's talk about some of those technologies that we that support that trend toward deploying those services at home. So first one is probably one of that's most impactful is remote patient monitoring. That's driven to a certain extent by wearables, but not only that. And then I will talk a little bit about patches, implants, what are the home-based diagnostic devices, what are software and hardware we can use for medication adherence, how we can use technology for companionship and education, and then artificial intelligence, chat, GPT, analytics. You know, how can we formulate care plans that are as automated and as easy to consume as possible. So I will go through each one of them right now. And the remote patient monitoring, you may be all familiar with it, but one of the things that we're learning is that not a lot of people know that this process is today very practical, very inexpensive, and very reliable. What's going on, you see here example of the blood pressure monitor. When the patient gets this device out of the box, it has a battery in it, it's configured. the patient, all they have to do is to put the cuff on and wait. They don't have to do anything. It will automatically detect that you put the Velcro on, it will pump this and send the information securely according to HIPAA standards through your cellular tower. So that device is like your phone. We don't even need to use the Bluetooth. So nothing could be simpler than that. And we see that a lot of doctors sometimes think that the remote patient monitoring requires a lot of training of the patients and a lot of support for devices. That's not the case anymore. This is one-click operation, and I mean, whoever is a provider of it gets the information in the cloud service, and that information comes to the nurses or the doctors on the desktop, allows them for management of this. At the same time, you see here on the right-hand side, the patients gets the smartphone app, and they can look at the blood pressure, pulse rate, oxidation, so on and so forth. And when they click on the blood pressure, they get a historical information about the trends in the blood pressure. So what happens is that with the remote patient monitoring, when the physician has the first visit with the patient, let's use the blood pressure. They will set the thresholds for each of the patients. The thresholds become a part of the profile of the patient. And if the patient reading is above certain threshold, this type of information gets distributed to whoever needs to know. And this could be either text or email. And this is where we can get family involved, we can get caregivers involved, primary doctors or nurse practitioners, nurses. In the case of physician practices, what we do, what also other providers do, is that there will be a nurse that is a part of the remote patient monitoring team, and that nurse will do a triaging and making sure that there are no false positives, and only the information that is deemed important as defined by the protocol will get to the doctor. So the point is that this can be deployed with any additional work on the physician or the support staff work. They will only get the information when it's relevant, and this can also be passed to the electronic health records. So the physician portal also allows those providers to initiate immediate telehealth call. So if they see that your blood pressure is 190, they can immediately reach out to a patient with telehealth visit, and vice versa. If the patient having all those devices and is concerned about something and wants to talk to a provider, they can initiate the call directly from the smartphone. What's practical today as far as remote patient monitoring is we can measure blood pressure, pulse, oxidation, glucose, weight, steps and exercises. There's a lot of integrations with Apple Watch and Fitbit, and we can then combine the vital signs of medical grade with exercise and activity, calories burned, sleep quality. Very interesting set of data. This is one of my favorite charts as far as remote patient monitoring, showing the relevance of measuring certain vitals across various specialties. And one of the things that is blood pressure monitoring is relevant to any specialty. And probably not by coincidence, whenever we visit the doctor, everybody gets the blood pressure measured, because that's the key thing. And actually, this one is the easiest to do and the most reliable today out of all the RPM devices. But you also see that pulse and weight comes across, so is sleep, and some of them are intuitive. And in cardiology or in endocrinology, the more you track, the better. So depending on the condition of the patient, the doctor basically describes the right protocols and combination of measurements. Let's talk about wearables now. So we left the remote patient monitoring, which may include parts of wearables, but this is a very interesting trend Wearables we define as smartwatches, fitness trackers, heart rate monitors, blood pressure monitors, ECG, sleep monitors, health rings, fall detector. So, for example, Apple right now is really heavily involved in a lot of things we can get out of Apple. As far as most of those things, maybe with exception for blood pressure, but it's coming up. There's already a wearable watch that you can measure blood pressure continuously. It's not approved by FDA, but those sort of things are coming. So we see the wearables, especially Apple Watch, playing a more and more important role in helping us to collect the data and monitoring. On top of it, the wearables, it was when there was dementia patients or cognitive decline, they can support geofencing. So let's say that will prevent or alert somebody, family members or caregivers about a patient wandering around beyond the perimeter of the house. They come with the fall detection. So we see the wearables being more and more sophisticated, more and more reliable, more and more functions being FDA approved, and integration of this data with the data coming from the other vital sciences where we see a lot of potential. As far as patches, the continuous glucose monitoring is probably the most important patch as far as home care that we know of. The technologies right now allow, you just put the patch on it and it can display it not only on this device, but it can display on your smartphone and can send this data again to the location, to the doctor or nurse office, just like we showed it with the remote patient monitoring. So now instead of pricking your finger and doing this once a day or twice a day, you have a continuous reading of the glucose in your bloodstream. And again, we can set alerts and know it. This is very, very, very convenient way, non-invasive. That's another thing that we see in the home care, the trend toward non-invasive help. We don't want to have devices that are hard to use or invade the lifestyle. The less obstructive they are, the better, and the trend is going that way. And we are talking about implants. There are a lot of implants. I summarize them here for you. There are deep brain, there are cardiac, insulin pumps, gastric simulators. There's a lot of them. There are more and more. Medtronic is coming with new ones almost every 6 months. And the idea is that you implant them, again, non-invasive. They are not getting in the way of lifestyle, bathing, and day-to-day operations. And so the list will be only growing. There is another very interesting thing, the smart toilets. How can we do not just monitoring at home, but how can we diagnose at home? The smart toilets trend, meaning that the toilet seat could be a sensor that can measure blood pressure, temperature. It could be a scale, but you can also deal with specimens, sending it to the labs. You can do a lot of detection and diagnostics from. We all have to go to the bathroom at least once a day, non-invasive. You don't have to do anything. You don't have to even put anything on you. We see the improvements in technology will probably, whatever wearables allow us to track, the toilet seat can track as well, probably even more. So that trend is very interesting because that would require zero training from anybody and zero technological support, as long as that device works reliably and transmits the data. And second one, I know that the second very interesting thing is going to machine learning and processing of images. And you can have a smart mirror that takes a lot of pictures, constantly takes the pictures and can detect heart rate, can detect depression, can detect, from your breath, it will detect how much wine you had last night, and things like that, whether you smoked or not. Facial recognition can do stress, anxiety, stress, and also if you take a lot of pictures and let's say you have a little mole on your face with the very high resolution imagery, and let's say you're taking that picture every day, or you can diagnose something that is growing, increasing in size, and maybe of concern and needs to be referred for the checkup. So this is an example of non-invasive types of things. They of course bring about the issues of privacy and security of the data. So our presentation is based on the premise and assumption that the security and privacy data is completely 100%. We also all know that in practical situations it's impossible in the real world, but that's the guiding principle. Somebody always can get hacked, but the idea is that you control all this data, and of course HIPAA compliance helps with it, but patients are not going to use those devices if they have any doubts about security and privacy of the data. So that's of utmost importance. But if we follow those rules and we can enforce them, then the data collection will only be better and more valuable. Let's talk about companionship. We all know that, especially for folks who are at home, very large percent of people live alone, and they have issues with companionship, that mental health, we haven't talked about it, but also telemedicine, of course, can provide the mental health services over the smartphones, but why not prevent them with companionship? So there's a company in Florida, in Miami, that started, I think, I don't know, 4 or 5 years ago. And right now it's worth $1.4 billion valuation. And all they do is to connect people who are at home and they're ill or elderly or both, have a limited mobility, or just they want companion, and it connects them with local students of, let's say, nursing schools, local pre-med students, social worker students. And what that site is doing, imagine like Uber, instead of asking for a ride to somewhere, you're asking for companionship. Those are services that don't have any clinical component to this. It's playing games, going to the movie, going to to do shopping, walking the dog together, anything about companionship you can imagine. It benefits both sides, and all you have to do is to register, ask for companionship, and then you select people who you want to interact with. It is covered by Medicare, it's covered by insurance, and the students make about $22 per hour when they work for Papa. So this is a local Florida company, and we're not endorsing them. We don't have any stock in them, but this is a very interesting, a beautiful example of leveraging smartphones to address very serious problem. And as market says, it's worth a lot of money. This valuation even surprised us. The next one is, of course, education. We all know about the health portals. They're getting better and better. And we know that, especially at home care, a lot of times the caregivers are family members. And when you get discharged or you have certain condition, everybody will benefit from getting educated, what causes blood pressure, how to avoid it, what are the best processes, what are even including the instruction of how to use the equipment that you have at home to address things. This is all lends itself beautifully to online education, that it's tailored to that particular condition. So this is not going to be loaded with a lot of data that is not, or information content that is not related to your condition. You can tailor this only to this, and you can imagine having a private network of people who have, imagine the private Facebook group that is made of people who have high blood pressure or caregivers of Alzheimer patients. I'm not talking it will be Facebook, but there are private networks that allow for patient engagement and sharing the information and getting family involved, caregivers involved online, education, companionship, interaction, engagement. Med adherence, one of the interesting things, the medical, I mean, the medicine as the drugs, prescription drugs are very, very high percentage of the overall cost. And it's nothing worse than you prescribe the drug, patient goes home and doesn't take it. And if they don't remember, and as a provider, you don't know if they took it or if they didn't take it. And there are several technologies. There are smart bottles that are connected, so you can see if there was dispensed. There are reminders on the phones. You know, so let's say you have a iPhone, it will remind you, did you take it? You check it off. So the probability, first you will be reminded of it. You know, I take supplements, and every other day I forget to take them. You know. And I'm not sick, I don't have any medical condition, I just don't remember it. There are more important things. And the same is with, so remind me that I need to take it, and let's check off by tapping onto a screen that I took it. And if you do that, you'll probably increase the probability of having a good picture by provider, by the physician, whether that drug was actually taken, because if it's not, all of these efforts go in vain. So there are creative ways of assuring med adherence. Then let's talk about big picture. We shared with you all those beautiful technologies, all those great technologies that can be used, but they value really depends on them being all connected with each other. The trend in the industry from the technological perspective, I'm not going to bore you with the technical detail, but fortunately there is a common language of exchanging data between all of those devices called API, and all of those devices that I showed you have those interfaces. So what's possible is to create that very large, beautiful database that will have all those measurements and all the daily readings of blood pressure and glucose and oxidation, whatever needs to be done, medication adherence, communication. It is all technically possible to do it. But if it's not done, the value of that system decreases exponentially. And conversely, on the positive side, the more connected they are, the more data we can get, data points. And right now, every device that goes on the market is configured that can communicate with other devices. So that's very positive. All we have to do is to put them together. And once we put them together, we can use artificial intelligence. ChatGPT just came out in November of 22. So it's 6 months, right now a little more than 7 months, really. And already makes a tremendous impact on medicine. The ChatGPT actually passed the medical exam in the 10 top percentile. So this language model is beautiful for diagnosis of the, let's say you have all this data that we talked about, all of this data that we shared with you, all those devices communicate, and of course they go to the electronic health records of the provider, and then they become the basis for doing beautiful AI diagnosis, and also AI based, in this case ChatGPT based care plans, because ideally what the patient and the caregiver should get is a very easy to understand and check off health plan or care plan, and they can follow it, so the provider can see it, they can see it. All of this doable today with ChatGPT, both on the diagnosis and formulation of those care plans. And if the patient is, or the caregiver is checking this off, then we have a beautiful adherence, not just to medicine, to the drugs that were prescribed, but even more important, to the whole care plan. So the more complex the care plan, the harder it is to physicians to keep track of the compliance with that care plan. So the ChatGPT or language models are going to help with this. We see the future of it. We expect that there will be a lot of health models that could be specific to certain conditions, but I want to share with you the one that already exists. It's free online, called Dr. Gupta AI, an example of ChatGPT driven diagnosis. What you see here on the right, you put the vitals. This right now, it's a website. You have to type it in, but it's very easy for anybody to imagine that this is integrated with your EHR system, and this will do diagnosis on the fly. To ask you know what you're taking, what you're not taking, what are your allergies, what happened to you, and it will do that. We don't think that this will ever replace doctors, but will for sure help them with the diagnosis. The amount of medical knowledge is increasing exponentially, but there's a limited capacity of memory of any doctor. So what we see going there is that those language models, ChatGPTs and other competing models will be supplementing, helping basically a doctor to make sure that they didn't miss anything. We don't think this will ever replace doctors, but will have a significant, just like Excel supports accountant today, you know. Yes, you can do it by hand, but probably you don't want to do it. So this is a similar situation. So in the summary of what we wanted to talk about is that we see a lot of this trend toward going to home is indeed right now both practical and both technically and the business model, because those technologies are very inexpensive as compared to unnecessary emergency visit or unnecessary hospital admission or unnecessary hospital readmission. They're rounding error compared to those expenses. So the technology, as I mentioned, is going to get cheaper, better, faster, and the wearables and all those non-invasive technologies will get even more capable of providing this enormous amount of relevant data. And that relevant data means nothing until can get really translated to what I mentioned, actionable care plan, actionable steps that people can check off their devices and to assure the compliance with the protocols. So I would like to share one case study right now. So we're talking about in-home care. This is a case study from Department of Elder Affairs, state of Florida. What happened, remember last year we had a Hurricane Ian, and that hurricane wiped out 2 senior living facilities near Orlando. And wiped out meaning flooded, actually, both. And in case of one, everything was destroyed, and another one was flooded. So there were some records and some things. So the state of Florida, the emergency crews brought 115 residents and put them in one of the hotels in Kissimmee, in Westgate Towers. But the problem was, yes, they had food, they had shelter, but they were completely deprived of medical care because the primary doctors got flooded, the health record got flooded, so there was nobody who could help them to medically. And so what's Department of Elderly Affairs was hired a virtual health company and personal health monitoring. And what happened is that they put on the week notice, put the on-site clinical director there, on-site nurse practitioner. There was a supervision from online primary physician. There's a EMR system because there was no records for those patients anywhere. So it has to, everything has to start from the assessing the health, and all the lab work was facilitated prescription refills. But according to that model that I shared with you as virtual health, we also made sure that they had the nurse assistant and the skilled nursing support on the on the premises. So this would be like coming to 115 homes, you know. In this case, they were all in one hotel. However, the hotel didn't even have a conference room. So they were also separated, isolated among themselves. And what happened using all those technologies some of those technologies that we discussed, because this was like doing a healthcare at home. This is the result of 2 months of that project. The blood pressure was monitored, glucose. There were 6 ER visits prevented, wound management, anything you can imagine being associated in that type of circumstances. But this is probably the closest to imagining trying to deploy the healthcare to 215 homes. And that would conclude what we wanted to share with you. We'll be more than happy to answer any questions that you may have about that trend toward healthcare at home.
Thank you, Greg. It does look like I do have one question for you.
Mm-hmm.
What existing technologies are the best investment with respect to in-home care?
I think probably out of everything we showed you today, the most mature is vital sign tracking daily, which is under umbrella of remote patient monitoring, because the cost of those of tracking and those devices are not even in hundreds of dollars, and services not in hundreds of dollars per condition. So as far as investment that's probably the lowest hanging fruit as far as how we could manage chronic diseases. And another thing that is worth mentioning, that all of those technologies that we showed you to manage health at home can be used also in the prevention or fitness, because, you know, let's say the patient is now cured and doesn't have any chronic condition. It's probably in the best interest to stay fit and take care of the fitness. So keep tracking your vitals and your movements and your exercise is probably valuable regardless of what conditions you are. And conversely, if you're fit, one day you may be chronically ill. All those technologies are relevant for both prevention and treatment. So that's also that makes it also the single best investment you can make. And another one, I think that anything around Apple Watch and wearables, you know, Fitbit, something watches, this is more on the prevention side, but they provide enormous amount of information, especially if you're trying to address, you know, diabetes, being overweight, and or needing any type of dealing with need for exercise as a part of your regimen.
Okay. One more question for you. What percentage of primary care can be delivered remotely?
That's a very interesting question. I will answer this question by citing what we learned. We were talking to folks who have the orthopedic virtual practice. And the folks there told us that 95% of diagnosis for orthopedics, I was very surprised, can be done over the phone, over the video. So they don't have to, my initial impression was that's almost impossible, but what they explained to us is that when you come to the office, all they ask you is to, you know, to bend, reach out, something like this, and from that you can diagnose range of movement and you can diagnose what may be wrong, and they can do it over the phone. So this is on diagnosis. The answer in orthopedics was 95%. And another interesting trend is that physical therapy today can be delivered over the phone. You can have the kind of a little bit of a sensor on your wrist And if you start exercising in front of the application that's loaded on your phone, the application will record your range of movements, will provide you with the statistics on how many repetitions you did, and sometimes even whether your range of movement is good, because not how you exercise is also important, how many reps you do. So today the technology can help you to do that remotely. So again, this one, I don't know if it's 95%, but the physical therapy in that way, for sure, more than half of it could be done. So on diagnostics, a lot can be done. And on the tracking of vitals, that's 100% answer. Overall, let's put it this way, that number is growing, and it will be growing because more and more services will be feasible to be delivered remotely, or not remotely necessarily, but at home and remotely.
That's really interesting, Greg. Thank you for sharing that information, and thank you for your time today in this presentation, both to you and Charles. Is there anything else you would like to add today before we end our presentation?
Are you asking us, or is this a question for the audience?
Yeah, you. I wasn't sure if you wanted to add anything else prior to.
No. Thank you all for. Thank you all for participating. I think it's a fascinating topic because this is a perfect example of how technology and data analytics can help solve practical problems. And this is not hype anymore. This is reality. And on top of it, it can pay for itself. Even Medicare started to reimburse remote patient monitoring. So even business models are now all feasible.
Thank you for that, Greg. We will also be sending out an email with contact information. So if you have any follow-up questions, please let us know. A link to the webinar recording will be included in that email. Please feel free to share that link with anyone that you think may be interested. Just a quick reminder too that our fall conference is coming up October 25th through 27th. We hope you have a great day, and thank you again for your time.
Thank you.
Bye-bye.
Bye-bye.